What is fatty liver? Non-alcoholic fatty liver disease is an increasingly common condition marked by accumulation of fat in the liver cells. In some cases, fatty liver can cause inflammation and scarring and even lead to liver failure or cirrhosis. What causes fatty liver? Often occurring in people who are overweight or obese, fatty liver has been linked to diabetes, high levels of blood fats, and insulin resistance. In fact, a 2009 study suggests that approximately 70% of people with type 2 diabetes may have fatty liver, and that the disease might follow a more aggressive course for diabetes patients. Standard blood tests at your doctor's office should indicate whether you have a high level of certain liver enzymes, a marker of fatty liver. How do you treat fatty liver? Current reports indicate that more than 1/3 of North Americans suffer from a fatty liver, and left untreated, it can progress to liver inflammation, cirrhosis, and liver cancer. Storing excess fat in your liver greatly increases your risk for diabetes, heart attack, stroke, certain cancers, and premature death. Whilst those are usually unseen, obesity is another very visible symptom of a fatty liver. However, fatty liver is a condition and not a disease, and therefore can be treated without the need for expensive pills or surgery. It can be reversed. How to treat fatty liver? The liver will only burn off the fat if it is called to do so. That requires the blood sugar to be lower than the threshold where the body says it needs no more sugar. It does not need to be so low that the body craves sugar. This is often the idea behind sudden weight loss diets, but it puts high stress on the liver and may only work for the short term. Restricting carbohydrates is more effective than simply cutting calories or limiting fat intake for those who want to reduce the amount of fat in their fatty livers. In medical tests, low carbohydrate diets led to greater reduction in fat from a fatty liver and longer-term sustained weight loss than low-calorie diets. This is because the lowering of the carbohydrates, especially those that generate fructose, makes a slower but sustainable way of asking the liver to burn fat in order to maintain a healthy blood sugar level. The purpose of restricting the carbohydrate intake is to maintain a non-high blood sugar level so that the liver burns off slowly more fat than it stores. This will always lead to a slow but consistent weight loss until you reach your ideal in-balance weight. How can we do this? The full details of what foods and drinks can be consumed as normal and reduce a fatty liver are outlined in a holistic treatment guide for fatty liver called the EZRA Protocol. It outlines the foods that boost blood sugar more than others and those that can easily be replaced with other common food items so that your diet is about maintaining a healthy blood sugar level rather than trying to starve yourself. Some quick tips that anyone can use to reduce a fatty liver are: avoid all sugared drinks, reduce fruit juice, table sugar, reduce foods made from flour, eat plenty of vegetables, berries, beans, nuts, eat fish, reduce meat, especially cured meats. Changing diet is probably the biggest single thing you can do to reverse fatty liver disease. Simply knowing what to cut out and what to eat at different times is often all you need to do to make dramatic changes to your health, weight, and fatty liver. What would you say if a recognized expert would offer you a plan which would give you 6 months of a fully customized diet plan for fatty liver and obesity victim sufferers? Find out more by clicking the link below. You'd be surprised how well this works.